Everybody. So this is our second Careers in Care clinic. We ran one yesterday. We've got a third one running next week because of the popularity of them. And it was great fun yesterday. We're really excited. We've got a good session for you today. And our objectives largely are around giving you some top tips to help you either start your career in care or to develop and progress your career in care. So whether you're in care or looking to get into care, then this session will give you some useful, interesting takeaways to help advance your ambitions. What we're not going to cover specifically today is talking about international workers and how international workers might get into care in the UK. But we have got some guidance for you, so we are going to signpost you to some appropriate information, and I'm sure there may be some related questions at the end that we'll cover off as well. So that's what we're here to do. Very much looking forward to presenting this. I am Mark, and my role in FuturU is Head of Learning Innovation. So my team is responsible for developing all of the learning content that you experience on the platform. If you're not part of FuturU or you're not accessing the online learning as part of New Cross, then I would encourage you to sign up. It's free to access. You can download all of your certificates. There's over 100 courses there. Most of them are CPD accredited. All of the important ones are. And skills for health aligned. Yeah, you can get on there and you can learn to your heart's content. And in my career, I have focused my career on learning and development, and particularly supporting people and teams and organizations to improve the way that they develop and grow people's careers in line with the businesses that they work for. So that's why I'm particularly excited to share some knowledge here, but my knowledge is nothing compared to the insights that we have from Lewis. And I'm delighted to introduce Lewis from New Cross Healthcare. Lewis, do you just want to explain a little bit about who you are and what you do?
Yeah, of course. Thanks, Mark. Yeah, so hopefully I can provide some really useful insights for all of you guys. So my role is that I'm the Director of Workforce at New Cross Healthcare. What that means is that I am responsible for the recruitment, onboarding, compliance, ongoing engagement and training of staff within New Cross Healthcare. And New Cross Healthcare is a staffing agency. We supply staff to care homes, social care providers, hospitals, the NHS across the United Kingdom. Prior to that, I've had a history of working, well, my whole working history has been in health and social care, in service development, and prior to joining New Cross, I was running mental health hospitals all the way from psychiatric intensive care units, forensic units, acute hospitals, an eating disorder unit. So I've hired hundreds of people in my career, and now my new job is focused on hiring the best quality people to supply multiple services across the UK. So I'm looking forward to meeting you all and giving you some insight and answering some of your questions at the end.
Lovely. Thank you very much, Lewis. And yeah, I'll be inviting you in to share your unique insights as we go through. In terms of what we're going to be covering today, so first of all, we're just going to think about what makes a career in care such a special thing to embark on or to develop, and why care is a really great career choice. Then we're going to be thinking about the different career paths that you may have open to you in care. And what I want to suggest there is that it's a very wide, diverse set of opportunities that are available to you. Also, we're going to talk about essential skills and qualifications. I'll be covering off the qualifications part. I'm sure there'll be some questions around qualifications. But I think what the most important bit is there is talking about the really important behaviours, kind of soft skills that determine a great carer from a good carer, and how that can help you progress in your career. We're going to give you some effective job hunting strategies and some CV tips and advice, thinking about how you present an application to for a career opportunity in care, and thinking about how you present yourself in interview, those kind of nuts and bolts things. And then I'm going to offer you some signposting to a place where you can identify what career choices in care are appropriate for you. And also, I'll be just letting you know that on the FuturU platform, there will shortly, in the next week or so, be a career aspirations assessment available to you to undertake as well, which I think is an interesting little tool and might just help you make some decisions about your career journeys. So that's broadly what we're going to be covering. Hopefully we can get through that in sufficient time to leave a good amount of time for questions and answers. But as yesterday proved, there's lots of questions, so we may have to come back to you after this session with written responses. Yeah, we'll see how many we can get through. But the first thing that I want to cover is, why would we choose a career in care? And the thing I really want to say here is that I am in awe of carers. And I think generally people are. And we know that in care, particularly at entry level, it is not the best paid of occupations. People don't go into this for the money. But there are certain aspects of the care sector that do make it a really positive career choice. So it's certainly the most rewarding. You can see the impact that you can have directly on individuals every day. And while it may be one of the most challenging and certainly emotionally taxing roles, there are certain aspects of care that allow you perhaps to manage work-life balance in a way that a 9-to-5 job wouldn't. It's a sector that is generally short-staffed, so care workers are always in demand. So it's one of those sectors that you're unlikely to be out of work in because there is such high demand. And as we're going to demonstrate, there are real diverse opportunities as you progress your career in care. So it's not that you kind of get stuck at a point where you're offering direct personal care to people. That if you want to expand your career beyond that, there is a whole range of opportunities and choices available to you. So why people choose a career in care? Largely, it's a very rewarding job to be undertaking. It's a very rewarding sector. You get to see the immediate impact. It's always in demand. You're always going to be in demand. And there is this wide range of diverse opportunities. And when we think about what particular career paths might be available to you, I just want to share a few things. So first of all, let's say that you start out in care, you join a care organisation at entry level, and you'll be doing kind of basic care tasks. You'll have a basic set of responsibilities. You may be doing personal care. You'll be supervised and handheld throughout that process. But as you progress your career, you've got certain choices to make. So you can either broadly specialize, so you can go deeper into the topics that you are interested in. So perhaps explore dementia or explore mental health, or things like particular kind of clinical care needs. And that might take you down a specialism route that leads to a professional qualification. So, for example, this might be a nursing degree, an associate nursing degree. It may be the therapy route, so a speech and language therapist, or a physiotherapist, or an occupational therapist. There's a whole range of specialisms that might be open to you. But it's not just clinical or care-related specialisms. It could be looking at specialisms like, I don't know, becoming a CQC inspector, somebody that goes round social care organisations and actually determines the quality of care that's being provided. So as you progress your career, you need to make a decision whether you want to specialize or whether you want to go down the leadership and management route. So that's generally moving from being a carer to a senior carer, a team leader, shift leader, maybe a deputy manager, a registered manager, and then moving beyond that into business management and corporate leadership. And all of those opportunities are available to you. They're all supported by qualifications, which I'll come on to. But there are other aspects that I think are important for you to consider. So the first one is, as you progress your career in care, what kind of clients or people is it that you're best suited to be caring for and looking after? So it could be anything from infants, babies, children, young people, young adults, older people. It could be people with mental health challenges. It could be people with physical disabilities or learning disabilities. It could be people who have care needs as a result of their age. It could be a whole range of different things. So think about the kind of people that you want to look after and the kind of care needs you are best suited to be supporting. But also think about the environments that you might want to work in. So care, as I say, is a very diverse sector. You can be caring for people directly in their own homes, enabling them to live independent lives. You could be supporting people in a supported living environment. You could be looking after people in hospices or hospitals or care homes, residential homes, nursing homes, and everywhere in between. So think about the kind of environment that you want to work in. Certainly in New Cross, they often provide care professionals into prisons, for example. And prisons will have a fair amount of care needs related to mental health. And it's a very challenging environment, not suited to everyone, but some people really thrive in those kind of environments. The third thing to consider, so clients and environments, the third thing is the kind of employer that might be best suited to you. So would you prefer to work in a large, more structured organization or a small and more flexible organization? Would you want to work in a public sector? And there's real advantages to working in the public sector. So working for a local council run organization or working for a large private organization. They both have distinct advantages. And this is where I want to bring Lewis in to give his perspective on both New Cross as a large private organisation, but also thinking about the temporary worker sector. So, Lewis, do you want to share your insights here?
Yeah, of course. Thanks, Mark. Yeah, really good insight and sort of support everything that Mark has said. It's really important for anyone starting out in care. I think it's a starting point to look at the type of clients and environments they want to work in as a starting point. And then you can fit the employer to kind of meet those needs. And there's a multitude of employers within the United Kingdom which you can work in. There's public, private, and within the public and private sector, there's different types of employers across different sectors. And organisations such as New Cross, which provide temporary staffing across the UK, allow you to have the opportunity to work across multiple different service types and try different things out. What's really important is that you realise before you go to work for an agency such as New Cross Healthcare, that most reputable agencies require you to have a minimum amount of experience within health and social care before you can join an agency and work as temporary staff. And as Mark alluded to earlier, there's a huge amount of opportunity within health and social care. Get that experience, whether it be volunteering or starting out as an activities coordinator or a healthcare assistant or a support worker in any one of these different places. The public sector, you can work from an NHS hospital through to a local authority funded care home. The private sector has a multitude of different options as well. So there's the agency side, which obviously I work in, and then there is the private care homes, and you can go anything from a big private care home group with 200 care homes to a smaller care home maybe just one care home, sort of owner operator model. And within that, you might get exposed to a lot more. So you might be able to say, well, actually, I prefer doing the activities, I prefer doing the care, or maybe I prefer doing the support services, such as being a cook, or helping out with the housekeeping. In a larger organization, you're more likely to have a more structured route. And also within a larger private or public sector organization, the ability to be able to complete an apprenticeship will also be there, where some of the smaller organizations don't necessarily pay into that apprenticeship levy, and provide you with that opportunity. But there's pros and cons with both, and you'll find what suits you by a bit of trial and error. I don't think most people start in the career that they finish unless you're really, really lucky in life. So try a lot of different things if you're not sure. A really good way to explore what suits you as an individual is to work for an agency such as New Cross Healthcare.
Great. Thank you very much, Lewis. Yeah, we'll come back to you shortly. I think I noticed a hand up. While we're giving the presentation, if I could direct you to the chat and ask questions in the chat. Alex is monitoring that. She'll respond and pull those questions out at the end. And we'll invite you to come off mute and ask questions at the end, if that's okay. So now I want to talk a little bit about essential skills and qualifications. This is where I want to signpost anybody that's interested in our guide for international workers embarking on or joining the care sector in the UK. So there's a QR code there, and Alex will put the link to those resources in the chat as well. I would encourage you to have a look at those. I want to talk a little bit about qualifications. There is a whole range of qualifications that are directed at the care sector. And the access to these qualifications, it may depend on the employer that you choose. So as Lewis said, if you work for a larger organization, it may be that you are able to get access to funding for an apprenticeship, which would cover some of these qualifications. If you work for a smaller organization, they may have funding for other kinds of qualifications. And depending on your life circumstances, that may enable you to attract funding or otherwise. But broadly, at an entry level, you will probably need to have GCSE in maths and English as a baseline. And sometimes if you access an apprenticeship and you haven't got those qualifications, then it can be rolled into achieving one of those apprenticeships, and you can be supported in that, but not always. Once you've got that kind of base level of education, then the entry into care is often kind of the care certificate or the new level 2 adult social care certificate, which is a formal qualification. But there are a range of other kind of level 2 certificates or diplomas or awards in health and social care that you can get. If you live in Scotland or Wales, then you will be required to complete a level 2 qualification to register as a care worker in that country. It's not a requirement in England at the moment, but certainly in Scotland, you have to do an SVQ, a Scottish vocational qualification. And in Wales, you need to do a level 2 in health and social care. As you move beyond entry level and you move into team leadership or a senior care worker or support worker role, you'll be looking at a level 3 qualification. And then as you move into management, you'll be looking at level 4s and 5s and beyond. And beyond are things like nursing degrees, associate nursing degrees, and so on, which can now be done as part of an apprenticeship program too. So again, if you choose the right employer, my niece, for example, is on a nursing degree program, and she started work as a healthcare assistant in a local NHS trust, and has managed to do a level 2, a level 3, and now embarking on a nursing degree, which is great. And she's able to do that while she's working and while she's earning. So whole range of qualifications at different levels that will support you at different points in your career journey. But Lewis, I want to hand over to you just to give us some insight into the importance of behaviours and attitudes and the soft skills in care.
Yeah, absolutely. So I hope to provide you with some insight from my experiences hiring people working in hospitals and across New Cross Healthcare. The soft skills can't be understated. We're working in a people-focused business, and it's really, really important that at the forefront of everything we think about and our interactions is that we're working with people who might be someone's mother, brother, son, grandmother, granddaughter, whoever, and someone really cares about them, and we need to demonstrate that we also care about their well-being and the amount of trust that is placed in us to look after them. So if I was to sort of whistle it down to two key things that we always really try to elicit from an interview, there are a few more which I will go into in a minute, but the two really key things we look for is someone caring? Can they demonstrate that? As I just alluded to, you're looking after someone's loved one. And can you show initiative? So you need to be able to demonstrate instances where you've done something off your own back without being asked to do it. A good example might be in a care home where it's lunchtime and no one's laid the table. A simple thing such as saying to the nurse in charge or the carer in charge that you're going to go lay the table without being asked to do it, or you notice someone's pad is soiled and no one again has done that. So you speak to the nurse in charge, you say, look, would you mind if I helped the service user change their pad? These kind of things they can't be understated, because what you're doing is you're adding real value, and it demonstrates that you're thinking about people in a person-centered fashion rather than being task focused. So you're waiting for the next task and the next task. You do need to have a bit of structure in your days, and every hospital, care home, housing and care provider will have a structure. But when things fall down in care is when people get focused on tasks and not the people. So if you think care for the people first, everything else tends to fall in place. And so that's why we really look for those key qualities, sort of being caring and showing initiative. The other four things, which are sort of a more personal, but I'm sure they resonate with a lot of other employers across the business. Positivity, so it's looking for solutions. When something arises, it can be quite an emotionally draining environment sometimes, particularly if you're working in a frantic A&E or a mental health hospital, or even if you're one-on-one with someone with challenging behaviours in the community. It can take it out of you, so it can be quite hard to get, what's the phrase I'm looking for, to see the wood for the trees, or to see the positivity in the situation. But we've got to, when we're looking after people, we've got to try and find a solution. It doesn't mean that you have to be sort of happy and smiley 24/7. We're all human, but whilst we're at work, we're trying to find a way to support the people that we're looking after. That's what I mean by positivity. Empathy, being able to relate to the people we're looking after, is really, really key. It doesn't mean we have to have had the same experiences, but it's being able to understand that everyone's experience is different, and how they experience feelings is different, and we've got to support them with that. Honesty, this is really important. It ties into the next point, which is integrity. We're looking after people's loved ones as a people's business. You're being given a lot of responsibility and trust, right? These are people's lives we're looking after. And as a registered manager, as I was for many years, you're legally responsible for these people's lives. If anything happens, so you've got that legal responsibility from the manager being delegated to you. But I think more important than that, as I keep going back to, you're looking after someone's son, daughter, mother, grandmother, whatever you want to call it. And they deserve to be looked after right. And we've got to be able to be honest and feedback. If we think this process is wrong or someone's not being looked after right, the manager has to see that integrity in you, that you're going to raise that as a problem, so then that person can be looked after properly. And I think just some softer skills, that some more sort of direct feedback rather than talking generally speaking. I would when you're working, just making sure you're not talking past your service users. So when you're working, you're talking with service users. Too often I have seen staff members talking across people about their weekends outside of work. That's not polite, and actually it's not involving. Goes without saying, mobile phones, you shouldn't be on your mobile phones when you're with service users. You need to dress smart, be professional. What that does is it gives trust in you. If it shows you care about your own appearance and what other people think of you, it gives people trust that you're going to do a good job. So simple things such as being that respectful and willing to listen and learn will stand you in really good stead for a future in care. I'll hand you back over to Mark again now.
Brilliant. Thank you, Lewis. That's a comprehensive summary of the softer skills. And I think a real key point there is that that is not just for entry-level care professionals. These are soft skills, behaviours, values that I think will stand people in good stead throughout a career in care. So it's just as important for leadership or management to demonstrate empathy, integrity, resilience, honesty, all of those really important things as it is for somebody just starting out in their care career. The other thing I didn't mention there is about relevant certifications. So throughout your care career, you will have to maintain and update your competence in a whole range of different areas. So things like first aid, moving and handling, whether it's dementia awareness or safeguarding. And I would just encourage you to, if you haven't signed up to FuturU, to go on to FuturU to undertake all of those things. And it's free to access, and you can download your certificate for free. There is no catch. Okay, so moving on, thinking about tips for effective job hunting strategies. And there's a few things here. I'm going to rattle through this fairly quickly and get onto the next slide about CV tips and advice. But broadly, when you're thinking about where to search, I think a good phrase, and I'm going to keep coming back to this, is Google is your friend. So going back to the first slide with the roads and the signposts, excuse me, if you think about what appropriate employers might best suit your skill set or might suit you best in your career in care, then often larger employers like the NHS or local councils or big private providers will have all of their career opportunities and job opportunities on their websites. So that's a really good first port of call. There are some wider, more generic job sites like Indeed that will often post local care jobs. And a lot of employers use Indeed as a way of communicating out their vacancies. But you might also think about specialist recruitment agencies. So there are ones that are specialised in care. There are generic recruitment agencies like Reed, for example, that work across a whole range of different sectors, but often have quite a large care division. And I would also encourage you to think about online networking. So depending on what type of role your next career choice might look like, LinkedIn might be an appropriate place to go. If you join LinkedIn, particularly for kind of senior management level jobs or specialist professional jobs, often recruiters will go to LinkedIn to advertise their vacancies. And if you go on LinkedIn, you keep your profile up to date, you can subscribe to job alerts that will inform you when there is an appropriate job to your skill set in your area. So some really useful things there. In terms of tailoring your job hunting, so again, go back to thinking about the kind of clients that you want to work with, the kind of environments that you want to work with, as well as the kind of employers that you want to work with, and use that to really target your searches. So if you're interested in domiciliary or community-based care, then make sure that your Google search is finding those kind of organizations. And based on what Lewis said, have a think about what your transferable skills are and what kind of care setting they might be best suited to. So again, I mentioned about prisons. You may be a particularly resilient person who would thrive in that kind of environment, or you might be the kind of person that really wants to offer more companionship care in a support work setting with people with kind of lighter care needs. So think about what your transferable skills are, think about what kind of setting you want to work in, and tailor your job hunting to that. Now, we came across this yesterday. There is often a conundrum within care settings, particularly when setting out, that you need to have experience to get a job, but you can't get experience without getting a job. So again, have a think about what gaps there are in your experience and see if you can fill those gaps through other opportunities. And I did a search on this yesterday, looking at volunteering opportunities in my area. And there are a whole range of charities, websites that are offering those kind of opportunities. And it would look really good for an employer to show that you've developed your experience and taken that initiative that Lewis talked about to gain that experience. There's a QR code on this slide. I would encourage you to have a look at that link. Alex will post the link in the chat, and it's about your transferable skills. So it's a set of resources to get you to reflect on what transferable skills you have that might be appropriate to the care sector. I want to move on to CV tips and advice, and I want to bring Lewis in here in a moment. When you're applying for a role, whether that's through an application process that the employer has or a CV that you have to submit as part of the application process, it's really important to do a number of things. First of all, to focus on relevant stuff. So when you're applying for a role, writing a CV, whatever it might be, think about the keywords that that employer has said about that particular post and make sure that you're addressing those relevant skills that they're asking for. My advice here is to ask a friend to do that and help you with that. Often we're very modest about the skills that we have, and often another person, a friend or a family member, can see skills in us that we might not see in ourselves. And when I say make it relevant, it may be that you have a really great skill in limbo dancing, but it may not be particularly relevant for the care role that you're applying for. The second thing is about tailoring your application and CV. So while we're presenting our relevant skills here, we also need to be presenting our relevant transferable skills. We need to be explaining how we would suit this environment, this client type, and this type of care setting. So when a job advert says this is a fairly pressured, busy environment, then think, okay, what are my attributes that make me thrive in a busy and chaotic environment? How might I deal with that? And if you have got those attributes and those skills, then make sure that that comes across in your CV or your application. And if you've got particularly relevant key achievements, then I would make sure that you're putting those things in there. If you've had glowing feedback from previous roles, if you can demonstrate initiative through awards that you've had in other organizations, then make sure you're doing that as well. And that you can back these things up with specific examples. So here's an example of me showing initiative. This was the situation, this is what I did, and this was the outcome. And then finally, format. So we've got a useful guide here. Alex is again going to share the link in the chat. but make sure that your CV or application, whatever, however it might arrive to the employer, actually looks good. So make sure that it's concise, do a spell check, and this idea of having an effective personal statement. So it's really nice as an employer to see just a summary of you at the top, that you are a care professional with 10 years experience, you're a keen learner, and this can be demonstrated by the qualifications that you've achieved. You love working in a busy, collaborative environment, and are really interested in making a positive impact on certain client groups. Something like that would really be a great summary for an employer, and might tip the balance as to why they should choose you. Lewis, in New Cross, you're recruiting hundreds of people every week. What are the insights that you see, or the general kind of pitfalls that people fall into?
Yeah, so I'll give you some common pitfalls and insights. So a really easy one to fix is CV gaps. Just make sure everyone that has a CV gap at some point in their life, for whatever reason, it just needs to be explained, and that will save a back and forth. The more successful job applicants leave less questions for the recruiters, and it gives a good first impression that you've really thought about everything that the recruiter might think about. So it shows that initiative which recruiters are looking for. So please make sure you give a good explanation. And by the way, I feel like I shouldn't have to say this, but things like maternity leave are more than valid reasons to put in as a CV gap. People are often quite hesitant about that, but that is always accepted by recruiters in reputable companies. References, make sure you leave 2 good references, and make sure you leave your companies on good terms. It's good housekeeping, and good networking to make sure that when you're leaving any company, that you leave on good terms with the HR department, but also your manager, if possible. People change careers, managers don't hold it against you, and the value of a really good reference can sometimes be the difference between you being chosen between someone else and not. 99% of references are boilerplate, template references. They just do start date, end date, employed. But if you leave on really good terms with a manager, they might give you a glowing reference, and that could be the bit that makes you stand out. So I'd really emphasize that. And then I'd sort of reiterate what Mark said around the format, highlighting relevant experience. If you want to work in care, you don't need to list every task that you did whilst you worked at Sainsbury's, but maybe listing that you had some that you had responsibility for a certain section might be useful, but you don't need to drill down into every single detail just to fill 2 pages. It's more important that you highlight any relevant experience or the soft skills you got, maybe working with people whilst you're at the supermarket. It's much better to do that than to just give a task list. You need to bring your CV to life in a concise and clear manner. And then finally, I think just make sure you're spell checking. Every computer has spell check, but you'd be surprised by how many spelling errors we get. And again, that's a really simple thing which shows that you care and you're giving the interview and the job at the respect it deserves. So those are probably my few key insights and pitfalls that I'd like to gift.
Brilliant. Thank you, Lewis. And I would just add a final thing on there. When we're applying for roles in the care sector, we often have to gather certain documents, whether that's, like Lewis said, references or reference details, certificates of qualifications, right to work documentation. All of those things we can anticipate an employer might need to look at. So it's a good idea to have those and keep those to hand. And again, if you're accessing FuturU, you can download your certificates. You can make those available as well, and you could produce quite a useful pack for employers just to make that process more smooth. Okay, so we're just coming to the end of our session. There's just one thing that I want to signpost you to, and one thing that I want to let you know is on its way. So thinking about what career in care is right for you at the moment, there's a really useful resource. If you Google a question of care, there's a really useful skills for care, and I think in conjunction with skills for health, little assessment, and it will help you identify what kind of clients you might be best suited to look after, and what kind of environments you might be best suited to look after. But there's a whole range of other career advice on there for you as well. So that's available right now, and there is also, in the next few weeks, and we'll communicate this out, there will be a career aspirations assessment available for you on the FuturU platform. And that will give you some indication as to what kind of career choices you want to make around, do I go down the specialist route, or do I go down the leadership and management route? And it will offer you some tips and advice of things that you can do right now to help you get there. Okay, I think we've come to the end of our formal presentation. We've done a little bit better in timing than yesterday, but not much. So now we're going to open it up to the floor for questions, and Alex is going to curate that through the chat. Alex, is there anything coming through that you want to bring out?
So we haven't had any questions through yet, but as Mark says, if you'd like to pop any questions you do have into the chat, we will take a look at those. In the meantime, I just wanted to let you know that I've added quite a few links into the chat today. I will be sending an email out later on this afternoon with a link to a recording of the session in case you want to watch anything back. And I'll also be including those links in the email too. So if you don't catch anything during the session, don't worry, it will be there. But if you'd like to learn more about New Cross Healthcare, I've added a link to their website. I've also added a link to our blog where you can find tons more information on all things relating to careers in care. And finally, I've added a link to where you can download the FuturU app and sign up and get learning for free with us.